You're watching our coronavirus call-in show. This is where you call in and medical experts answer your questions. This morning, we're joined by Dr. Flattening, a doctor and the author of The Coronavirus, Everything You Need to Know About the Global Pandemic. We're also being joined by Dr. Anil Hando, who is Director Pathology at the Nanavati Hospital and BLK in Delhi. Dr. Parekh, let me begin with you. This morning, as so many cities across the country go into lockdown, I think the biggest question on everyone's mind is how long is this lockdown going to continue and how is this lockdown going to help? If you could give us some clarity.
Namaskar. Thank you for having me on your show. I can't comment on how long the lockdown is going to go on. It would be inaccurate for me to do so, not in government. But what I can tell you is what we hope to achieve by this. So the purpose of a lockdown is to what's known as flatten the curve. It's to decrease the number of cases at any one point in time. By doing this, we give the healthcare apparatus and public health officials some time to scale up testing and treatment facilities. And think about it this way. If we have 1,000 beds in a city of 1,000 ICU beds, and we have 1,000 ICU patients, everyone gets treatment. But if we suddenly have 4,000 ICU patients and only 1,000 beds, right, obviously 3,000 people won't get treatment and they'll have worse outcomes. So this lockdown period allows the government to slow down the growth of cases. And in the treatment facilities, it took 3 months for there to be 1 lakh cases. It took just 12 days for the 2nd lakh, and it took just 4 days to get to the 3rd lakh. So you can see how quickly this is growing. That's why we need to lock down to slow down the growth and let the health system catch up.
All right. Okay, Dr. Anil Hando is actually joining us from his car this morning. Dr. Hando, we believe that you actually faced some trouble at the border between Uttar Pradesh and Delhi and some traffic restrictions. Just give us a sense of that before we proceed with this.
So I have started from home at 7:30 in the morning, and you can see that it's already 8:30, and I've just been able to cross the border to Delhi. I've parked my car to a side, and I'm now talking to you. The reason why is it so? Because a lot of people are actually trying to get into Delhi, and as is a usual practice with us, we don't like to follow the lanes, and therefore all of us try to clog it down. It is not that the authorities are not trying their bit. They are trying their bit because they need to ascertain whether you are really required to be coming into Delhi or not. However, a lot of people are actually, most of the people who are trying to come in are actually either healthcare providers or some way connected to the healthcare.
Right.
But the problem is, since they are not following the queue, since there is no single lane, it's difficult even for the authorities to ascertain whether you are really going for that or not. So I sincerely request through your medium to everyone that please try and follow the lane at the border junctions, because it's important for people who need to come into Delhi for them to actually give patient care, because that's what we are here for, and that's why we're leaving our homes.
Absolutely.
So please help. Everyone needs to help in this, and everyone needs to take their role, responsibility pretty seriously.
That is indeed an important message. I'm going to throw this open to our callers. Shivraj is calling us from Rewari this morning. Good morning, Shivraj. What's your question?
Yes, good morning. So one of the leading pandemic experts recently in an interview to The Wire said that India needs to test more, and the numbers could be somewhere range between 20 to 60% of the population. So what is India doing in terms of testing, and what is the situation, the actual ground reality situation, that how many positive cases can be there in India right now?
All right. Dr. Parekh, would you like to take that question?
Yes, thank you. Thank you for the question. The expert you mentioned is the director of one of Harvard's institutes. His name is Dr. Mark Lippisch. And what he said is that between 20 to 70% of all adults would be infected over a 12 to 18-month period. Now, this is a projection based on evidence we have right now. It may change later. The simple answer is we just don't know. Until we test more, we can't know what the real number is. I don't like to speculate, but yes, it is likely to be much higher. I'd like to add something if possible. 2 days ago, me and some of my colleagues, people much smarter than myself, appeals to the technology and management sectors in India to help us devise solutions to address exactly these problems. Within 24 hours, over 200 people from IIT, IIM, the smartest people in the country responded, and they are now working on these solutions, working on scaling up testing, treatment, all kinds of things. My humble request to anyone in power, industrialists, government officials, we are working day and night, 24/7, to come up with solutions to help the country. We should be ready with workable solutions, scalable solutions in the next 4 to 5 days. Please work with us. Please implement some of these solutions. These people are the smartest people in the country.
Yeah. Okay. All right. I am going to sort of take more callers at this point because our phones are literally sort of ringing off the hook. Senthil is joining us from Chennai this morning. Go ahead, Senthil.
Sir, this social distancing and frequent hand washing alone will help me to avoid this coronavirus attack.
All right. Let's take a few more questions. Satish from Chennai is with us as well. Satish, what's your question?
Yeah, to minimize the corona risk, whether alcohol will help us?
Pardon me, could you repeat that?
No, whether alcohol will help in reducing the corona risk of getting affected.
You're saying rubbing alcohol on your hands? Is that your question?
No, rubbing alcohol is okay, but taking it, normally people used to take alcohol also, right?
Oh, you're saying consumption of alcohol?
Consumption of alcohol.
Right. Okay. One more question. Kiran from Bengaluru. Kiran, what's your question? All right. We don't have Kiran at the moment, but Dr. Handu, that if you want to answer that question.
So that's a very interesting query which he asked. I would rather say that, you have the alcohol, use the alcohol in the hand rubs and clean your hands regularly. Having social distancing would probably make far more efforts. Just consumption of alcohol and knocking yourself down and sleeping off probably is not the right option at this point of time. I would strongly desist people from doing that. The other important aspect is that social distancing is what we are all practicing currently, and that's why we are wanting all of us to be away from each other. The idea is that as my co-panelist had already said, that, we are trying to flatten the curve.
Yeah.
And this is what our aim is. And we are also trying to make sure that the community spread is minimized to the lowest possible ebb. Just to add a few more words with respect to testing, the government has already, has established its laboratories across the country, which are almost about more than 150 labs, which are working day in and day out to get the testing done. Of course, we understand for the kind of population that we have in the country that this kind of, number of labs might be lesser. So the government has also come out with the number of private laboratories which have been given the mandate to go ahead and do the testing.
Yes.
However, one needs to remember that only 4 or 5 have, already gone into that mode, which have been approved by ICMR and it's on their website already. There are many others who are trying to get into this mode of functionality, which will take some more time. So as far as testing part of it is concerned, I think we are in that process. The country is geared up, and we will hopefully have better solutions also in due course of time, and which might make it easier for us to test.
All right. Okay, Kiran joining us from Bengaluru now. Kiran, what's your question?
Hi, we are trying to be home throughout and we're following it, but two questions is, how do we handle our pets? Pets, we take the pets to walk and everybody is spit on the road, and can they catch any of these viruses? That's one question. Another question a lot of people are talking about is getting a newspaper from the newspaper vendor. These are the only quick questions. That's it.
All right. I'm also going to take one more question before we take that across to the doctors. Manoj Soni joining us from Noida this morning. Manoj, what's your question?
Hello?
Manoj, go ahead with your question.
Yeah, Doctor, I just wanted to check up one important thing is that we have been recommending a lot of home quarantine at home. Could you kindly suggest what are the precautions to be taken at home? Because we are staying in a family of 3 or 4, so the social distancing needs to be there also. So could you just reflect upon so that we are more aware about what we need to do on our self-home quarantine during this period of the lockdown?
All right, Dr. Handu, I think a couple of those questions were on quarantine moves. So if you want to address that.
So as far as quarantining yourself within your home premises is concerned, the best thing would be, though this is not really an official recommendation from anywhere, but one must remember that the elderly are more prone to getting infections, and it is usually seen that younger people generally mingle around with more people even within the societies where they live. So the better thing would be to let the elderly be away from you as much as you can. However, as long as you're not leaving your own home to any other place and you're not mingling around with a lot of people, I don't think that should be a major challenge, because living with your own family has always been okay, and it is not really something that you're going to be taking out from the other places and giving it to them. So social distancing from the rest of the people within the society would be definitely required, because you do not know how many people would have been interacting with the other people coming from other places abroad as well.
Dr. Parekh, the question on newspapers. A lot of societies are now banning newspaper vendors from bringing newspapers into the colonies. And, you know, there are questions about whether newspapers can, in fact, continue to have the virus on its surface. What is your recommendation? What are doctors saying?
Thank you. It's a very important question. Just before that, I would just like to touch upon what Dr. Hando said. Yes, social distancing is very important, but perhaps what's more important is we call it physical distancing. So you need to be physically distant from people. That does not mean you need to socially disconnect. You should still stay connected. It's important. About the newspapers, yes, newspapers can become contaminated by the virus. So it is safer to switch to a digital version. However, I would also like to add that there is a huge industry for newspapers. There are many people in news media who will suffer, right from the people who print them to the people who come and deliver these papers. So while you take these safety measures, please also think about these people. Perhaps continue to pay the person who delivers your newspapers so he does not suffer, and he can also look after his family. Right. He or she can look after his family.
So there is a societal and economic aspect to all of this that we must keep in mind. David calling from Bengaluru. David, what's your question?
Good morning, and I have a suggestion more than a question to the panel. I would like to just, suggest that throughout India, people who live in cities, people who live in villages, that the health ministry, the health department with the ward officers make mohalla leaders who are in charge of, mohallas, apartments and villages, panchayat boards, who have a record on people and, tab on people of movement, and especially during medical emergencies. I live in one lane, make a leader for that, because people are still moving around.
Is that something? Okay, we take your point, David. But, Dr. Hando, is that something that is really workable when we're looking at a country as vast as India? Yes, certainly in some places there will be sort of designated people. But, beyond the point, how much can we police? Does it not have to be left up to citizens also?
So I completely agree with you. While on one side there is some degree of an effort in this direction by the Delhi Chief Minister and the Delhi Health Ministry, who are trying to, get rope in some of the mohalla-based stuff. But remember that, you cannot just let it go to everybody, because in any case, we are trying to contain. And when we try to contain, we need to have people who are, well-trained in that particular area to take care of the possible infective issues which can come up. And in such circumstances, trying to rope in everybody and trying to have everybody on board might become a bit more of a challenge rather than a help at that point in time.
And of course, vigilantism has already been a problem, Dr. Parekh. I mean, for instance, we reported on a story yesterday on how RWAs were in fact sort of ostracizing Air India staff who were going on these special flights to bring back our citizens from infected countries, including Italy. And these are heroes. They certainly don't deserve this kind of treatment.
Absolutely. I'm very saddened to hear that. In my own career, and I'm sure Dr. Hando has probably experienced this too, during a swine flu outbreak in Mumbai, when there was a shortage of beds in an ICU, I was almost assaulted. So we do have a culture in India where people do tend to lash out at people who are trying to help. And that's terrible.
Right.
To touch upon the earlier point about community leaders, in India we have a worker class known as Ashas, accredited social health activists. They're one of our most important public health resources in the country.
Yes.
And while we shouldn't take anybody, we can scale them up and we can empower them to help in this battle.
Okay. That's a very good suggestion. All right. Thanks very much. We'll take a very quick break, but be back with all your questions and we'll continue to go to our experts who will answer them. So we'll be back in just a few seconds. All right, welcome back. We're taking your calls on the coronavirus and indeed both the pandemic as well as the lockdown that's currently in effect. We have on the phone line now with us Umesh from Dehradun, I'm told. Umesh, go ahead with your question.
Well, good morning, everyone. Appreciate this opportunity and the steps which the government is taking. But I just fail to understand that the whole of PG shipping and the Home Ministry has been totally 0% over here when they have the entire data of all the people who have traveled overseas and come. And there has been no initiative to actually go door to door and check. That would be one major step we have to take when it comes to grip any kind of viruses like these which are there today or might come in the future as well. It's really surprising to see that. I'm
okay.
Really sorry to say.
All right. I'll take that across, but let's get one more caller in. Andrew calling us from Anna Nagar in Chennai this morning. Andrew, good morning. What's your question?
Good morning, doctor. My question is, what is the difference between the ordinary cough and fever, and what is the time gap between each one to, because the three symptoms together or each symptom will take its own time?
All right. Dr. Parekh, if you'd like to answer both of those questions, one, of course, on why health officials haven't been doing door-to-door checks, especially perhaps of those who've been quarantined already, and whether you think that would have helped, and this latest question also.
So to the first question, I believe the government is doing everything it can. It's a big problem to solve. You have to keep in mind what's happened in Italy and other countries in the past. This infection spreads in hospital, and then medical workers and healthcare workers can spread it to the community. So if you have a situation where we have a lot of patients in hospitals, and then you have medical workers visiting the community, going door to door, they could inadvertently carry the virus with them into the community.
Right.
So we have to think it's a very nuanced thing to think about. It's not so simple as to say, let's do this. The second question in terms of the symptoms, what typically happens, once you get exposed and get infected, you can start developing symptoms anywhere from 1 to 14 days later. Typically, it happens about 5 to 6 days later. The initial symptoms might be soreness, tiredness, body ache, very non-specific symptoms. A dry cough might develop, fever might develop. And by about 8 days after the onset of symptoms, breathlessness can start developing. When breathlessness starts developing, this is a very dangerous situation. It means the lungs are being affected. Some people may just steadily start progressing and worsen from there. A small minority of people might temporarily improve and then worsen, and some people might just improve completely. So there's a huge spectrum. There isn't any one pattern that this follows. That is why we tell people when they have a fever and cough, they need to stay home. And when they have breathlessness, they need to contact medical authorities, but call. Don't just go there and infect other people.
All right. Dr. Parekh, Dr. Handu, thanks very much for joining us this morning and helping our viewers and answer their questions. We'll continue to get experts to join in and answer all of your questions right here on NDTV 24/7. So do join us at the same time once again tomorrow morning. Thanks for watching.